Good morning, Dr. Holloway. Good morning, Ann. How are both of you today?
Very good, thank you.
Doing very well, thank you. How are you?
I'm doing wonderful today, and we have such an important topic, so I want to get right to the questions. So, Doctor, let's start with you. What can you tell us about the latest in ovarian cancer diagnosis and treatment?
What's really new with ovarian cancer is that we have many more women living with this disease, and that's because of changing treatment options over the past decade, getting much better response and allowing women to live with this disease. While 3/4 of women still present with advanced stage disease, about 85% will have a recurrence of disease, and that's where the new treatment options are coming in to maintain that remission.
And you have quite a story. What can you tell us about your journey after your diagnosis and your treatment? And like Dr. Holloway was talking about, is it similar to what he described?
Yes, absolutely. So what led me to discover that I had this disease was excruciating back pain and a trip to the emergency room where it was quickly discovered that I had to have emergency surgery. And after the surgery, it was determined that I had stage 3C ovarian cancer, which was absolutely shocking. Unfortunately, like many women with ovarian cancer, I did end up with a recurrence. And after additional months of chemo, my husband and I talked with my physician and wanted to have some information on choices. Originally, it was that I was going to be on chemotherapy the rest of my life, but fortunately, we found out that there was a maintenance therapy that I was a great candidate for. And that's why I'm here today to talk about how Tesaro has given us these options. And I want to help educate women that we do have choices today.
And so, Dr. Holloway, how typical is Ann's story?
It's actually very typical. And what's new today is that we have many more treatment options that, fortunately, like Ann, will place patients into remission after recurrence. But what's new is we now have therapies to maintain that remission. And it's a once-a-day treatment, and I might also prescribe this treatment called Zejula. Like all therapies, there are side effects, and it's important that you discuss the risks and benefits and pros and cons of maintenance therapy with your physician, but advocate for yourself. You can go to Zejula.com and read about maintenance therapy.
So, Ann, what are some things you would tell other women who may be going through a similar experience as yourself?
The most important thing is that even though it kind of may be inferred occasionally, it's happened to me, it's not in your head. So if something doesn't feel right, go and get it checked out. Ask lots of questions, talk with your doctor, find out what options are available to you, and you know, as in anything, my experience may be different than yours, but we've got choices today that give us the opportunity to live a more full life, and so I'm very grateful for that.
And Dr. Holloway, what other advice can you provide to women and their loved ones faced with ovarian cancer?
Well, I think most importantly, it's important for women to, as Ann said, listen to their bodies, make sure you're seeing your gynecologist once a year, getting your exams. Pay attention to family history. There are risk factors for ovarian cancer, and it's important that you talk to your physician about that. And once you have ovarian cancer, or if you're diagnosed with ovarian cancer, make sure you're seeing a professional that treats ovarian cancer on a daily basis. Outcomes are truly different when you're seeing physicians that routinely treat ovarian cancer. And advocate for yourself, as Ann says. Go online, read about it, ask plenty of questions.
Well, Dr. Holloway, thank you for giving us more information, and thank you so much for sharing your story with us today.
Thanks for having us today.
Thank you so much.